Hi, everyone. Welcome to the coronavirus update for the week of November 30th. I'm Sam Alcaine, Assistant Professor in the Department of Food Science, here to spike your week with a little COVID-19 knowledge. I hope everyone had a safe, socially distant, yet filling Thanksgiving. I think the question on everybody's mind is, have we peaked? And there are some positive signs. We're already seeing downward trends for both daily cases and for daily deaths. We're not, however, seeing downward trends for hospitalizations. So what does that mean? Could mean we're just seeing more hospitalized people, but our treatments are better. Could also mean that it was a holiday and reporting didn't keep up. We won't know 100% for sure until we get the numbers back later in the week. If we see very high numbers, it could just be because of a backlog over the holiday. The other thing that won't be factored into these graphs is the impact of Thanksgiving travel and gatherings. We'll have another week or two before we start seeing if that reverses our downward trends or if everyone did a great job socially distancing over dinner. In New York, the positivity rates for COVID-19 have definitely gone up all over the state. Western New York, Finger Lakes are particularly high, but you need to be careful wherever you are. Now, at the start of the pandemic, we were seeing a few facilities have positives and then have subsequent outbreaks within the facility. Now we're seeing more food facilities with positives, though fortunately they're remaining contained and not spreading through the food facility. So hopefully that's a sign that at least here in New York, we've got a lot of food facilities with effective COVID-19 safety plans that are doing their jobs. But if you haven't had a positive yet, don't think that means you're doing great. It likely means that COVID-19 prevalence rates were so low that you were never challenged. Challenged now, as Yoda says, you will be. So review your COVID-19 safety plans and think through what you'll be doing when someone calls in positive or with symptoms, or that they came in contact with someone who was positive or had symptoms. I highly recommend you check out this handy decision tree to help you think through what to do if someone develops symptoms at work or tests positive, and what to do if they're a critical employee. It can be found on our Institute for Food Safety website under templates and trainings. I'd also think about, how are you cohorting workers if needed because they, work very closely with one another? And who are their critical employees for your business continuity? And how are you going to keep them protected? And who are their backups? Now, you might have employees who already had COVID-19, recovered, and then find themselves re-exposed to COVID-19. What do you do? Well, the current guidance from CDC is that if they've recovered from COVID-19 within the last 90 days, they do not need to quarantine, but should watch for symptoms. If it's been over 90 days since they've recovered, they should quarantine because we don't firmly understand how long immunity lasts to COVID-19, and it varies from individual to individual. So play it safe. And that's your coronavirus update. Enjoy those Thanksgiving leftovers and stay safe by practicing social distancing, wearing your face coverings, and regularly washing your hands with soap and water or using the appropriate sanitizer. Look forward to seeing you next week. Thanks.